Hello and welcome to this video about neurological examination of the lower limbs. We'll first run through a demonstration of the examination and then we'll break it down afterwards into its sections. Of your legs, is that okay?
Yes.
Okay, are you comfortable?
I am, yes.
Good. So firstly I'm just going to have a look at your legs. And have a look at your feet. Good. Alright. I'm going to just roll your leg now. If you just stay nice and relaxed. Good. Okay. Stay relaxed again. I'm going to lift your knee very quickly now. Good. Good. So I'd like to check how strong you are now. So lift this leg up off the bed. Okay. Don't let me push it down. Good. And now lift this leg up off the bed. Again, don't let me push it down. Good. Now push me down into the bed. Excellent. And with this leg. Excellent. Bend your knee. Now push out against me. Good. Now heel towards your bottom. Excellent. Same on this side. Kick out. And heel towards your bottom. Good. Now can you cock your ankles up like this? Good. Don't let me push them down. Okay, and now push me away. Good. Alright. I'm going to check your reflexes now. So if you just relax for me, let me take the weight of your leg. Okay. Not same on this side. Good. So can you bend this knee now? I'm going to check your ankle reflex. Just relax your leg for me. Okay, relax that one down. Let's do the same on this side. Okay, good. Relax that down. Can you just do that another way? Relax for me. Good. Good. Okay. What I'm going to do now is scratch the bottom of your foot, alright, using this little blunt bit here. Okay? Again, just try and relax for me. Okay. And on this side. Good. Okay. What I'd like to do now is check your sensation, okay? So I'm going to touch you with this piece of cotton wool. It's going to feel like this. Can you feel that?
Yes.
Close your eyes for me. Just say yes when you feel me touch you.
Yes. 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 Yes.
Good. I'm going to do the same again now with this. This is called a Neuro tip. It has a sharp end and a blunt end. I'm going to touch your leg in a few places. I want you to tell me if you can feel it. So this is the sharp end and this is blunt. Can you tell the difference?
Yes.
Okay, good. So close your eyes for me. Now tell me if you feel sharp or blunt. So say sharp or blunt.
Sharp. 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 Sharp.
Good. Okay. Now I'm going to check whether you can tell what position your joints are in. So I'm going to start with your big toe. If you close your eyes for me, this is up and this is down. I'm going to move it up or down and I want you to say up or down. Okay?
Down. Up. Down. Up.
Good. Same on this toe. This is up, this is down. Ready?
Down. Up. Down.
Good. Okay. Finally, what I'd like to do is check your coordination. So if you could take this heel, place it on your knee, run it down your shin, lift it off and repeat for me. Good, thank you. Now with your left heel, do it on your right. Great, thank you very much. That's the end of the examination. Thank you.
Thank you.
So let's consider inspection first. This is the first thing we'll do. So we're looking at the muscles for muscle wasting and fasciculations. These are typically lower motor neuron signs. We'll then look at the feet for any evidence of calluses that might indicate a lack of sensation. Let's think about tone. This can be increased or decreased. Increased in upper motor neuron, decreased in lower motor neuron problems. So what we'll do is roll the leg from side to side, as you can see here. The foot lags slightly behind the leg in normal tone. If it's really floppy, it's reduced tone. If it stays with the leg, it's increased. Then what we can do is lift the knee sharply like this. Again, you can see that he's looking at the ankle, and the heel stays on the bed in normal or reduced tone. With increased tone, you'll see the heel flick up off the bed with the knee. You might like to do this slower and more exaggerated as well. So next we're going to check power. Now we check power at both the hips, knees and at the ankles. We do flexion and extension at both. It's a good idea to see if the patient can do it themselves first. So you can see here using one hand to push down on both legs. So we've done hip flexion, this is hip extension. Now here we're going to lift the knee and we're going to get the ankle off the bed so you can't use it as a pulley. Now you'll see the hand is at the ankle, giving you the most leverage over the patient. This one I think you can do with two hands together. So now on to the tricky bit, reflexes. Now we're going to check reflexes at the knee, ankle and the plantar response. Increased reflexes or brisk is upper motor neuron, whereas absent is a lower motor neuron. So we use a tendon hammer. For the knee, you want to bend the knee to about 30 degrees. Put your arm underneath like this to support it. Use the hammer, hold the hammer at the end to get the best swing with it. You can see both reflexes are elicited there. The ankle's quite tricky, you have to bend the knee out to the side. You can see him wiggling the foot there. What he's trying to do is relax the anterior tibialis tendon, which allows the calf muscle to contract. You can see the calf muscle contracting in both of these instances. It's about timing, that one. If the patient's not very mobile and they can't bend their knee like that, this is an alternative way. Essentially, you have to hit it as hard as you can hit your hand without it hurting. Next is the plantar response. He's using a Neuro tip here, the blunt end I should add. Really what you want to use is an orange stick. I wouldn't use the end of the tendon hammer because it's a bit harsh. Your nail should suffice usually. So once again we'll look at the plantar response. You can see the toes bend downwards or flex. This is normal. An extensor response is an upper motor neuron problem. Sensations next then. This is quite time consuming. We have to check 3 different modalities: soft touch, pain and also proprioception. So first here we're doing soft touch using a piece of cotton wool. What you do first is show the patient what it feels like on their sternum. Make sure they can feel it. Then get them to close their eyes and check the dermatomes. So that's L2, L3, L4, L5, remember that goes around from the lateral part of the calf, and then S1. Make sure that give the patient clear instructions each time, just to say yes when they feel you touch them. You'll be surprised how often patients don't comply with the examination. So next we're going to use the Neuro tip. Again, show the patient on the sternum, sharp and blunt. Make sure they can tell the difference. You have to actually ask them. Then go through the dermatomes again. I suggest you go through them all with sharp. Make sure they can feel them all. If there's any uncertainty at a dermatome, check with the blunt end as well. If they can feel sharp throughout, you don't need to. So there we go, down to S1 again. Next we're going to move on to proprioception. Now this is quite tricky. So you need to show the patient first what up and down is like. And make sure you hold the toe on the ends, on the side rather, so that you don't give the patient any clues by putting pressure
on the bottom or top of the toe. Isolate the distal interphalangeal joint as well. If you find a discrepancy in the distal region, it's worth checking the sensation from distal to proximal, looking for glove and stocking distribution. So finally, let's look at coordination. In the legs, this can be checked by assessing gait, looking for an ataxic gait, rather like the patient is drunk, or we can do it like this. So you ask the patient to take their heel, run it down their shin from their knee to the ankle. What you're looking for is a tremor of the leg, but also you're looking for the inability to do it. Their leg would slide back and forth and miss the shin altogether if the coordination is poor. That's called ataxia. So thanks for watching this presentation. We've been through the examination: inspection, tone, power, reflexes, sensation, and finally coordination. I hope that gives you a good idea of what's expected of you in the examination, and we can build on it from there.